I'm going to insert an indwelling catheter into my patient. I would first identify myself and identify the patient by having them state their name and their date of birth, and I would verify with their wristband. Before I would begin any insertion of the catheter, I would perform pericares on the patient. Expose them. Get out my sterile box, which I would have opened. I will throw that away because I'm not using it. And then I will put on my sterile box. First I'm going to fix this underneath the patient. Making sure my hands are staying sterile through it all. And then gonna open up my betadine. Squared out my lube. And I'm going to situate my box here. I'm going to test my balloon to make sure that it is working properly. Is. I'm going to remove my plastic wrap, making sure not to contaminate my catheter. Now it is time to contaminate. I'm going to take my first betadine swab and I'm going to go from front to back on one side. Front to back on the other. And down the middle. I'm then going to take my catheter and dip it into the lubricant and insert about 3 to 4 inches or until I see urine. Once I see urine, I'm going to insert it another inch. I'm then going to inflate the balloon with 5 mils. And take it off. Dispose of it in the garbage. I would dispose of it, and then I'm going to cover my patient right away just for dignity, put new gloves on to clean up my mess. And I would clean up the rest of my stuff. I would perform pericares on my resident, making sure I get all the betadine cleaned up. I would secure the tubing, which we don't have a thing to secure it with, and hang it on the side of the bed. I would lower the bed, make sure my patient is comfortable and access for any pain while entering the catheter. I would then like I said, make sure all my stuff is cleaned up and the patient is at the lowest position, side rails are up, and then I would go chart.